Assalamu alaikum. Beta, in this video lecture, I will deliver the pathology of osteoarthritis. Okay, so before I really start this topic, I must mention that the reference of this topic is from your textbook of pathology, that is Robbins basis, and at the end of this lecture, I will surely attach the written notes of mine. Okay, so let's start the pathology of osteoarthritis. So beta, osteoarthritis by definition, it is a degenerative joint disease. It is a degenerative joint disease. अच्छा, इसमें क्या होता है? इसमें आपका जो आर्टिकुलर कार्टिलेज है बेटा, उस आर्टिकुलर कार्टिलेज की डिग्रेडेशन होती है। ठीक है, तो कितनी आसान सी बात है बेटा कि ऑस्टियोआर्थराइटिस इज़ अ डिजेनरेटिव जॉइंट डिजीज़, जिसमें क्या होता है, आपका जो आर्टिकुलर कार्टिलेज है उसकी डिग्रेडेशन होती है। अब ये बात समझने के लिए आप थोड़ा सा इस पे गौर करें कि लेट सपोज ये एक साइनोवियल जॉइंट है जिसमें दो बोन्स पार्टिसिपेट कर रही हैं। यू कैन सी इट्स नॉट रियली अ वेरी गुड पिक्चर टू अंडरस्टैंड, बट स्टिल यू कैन get something from this. This is a synovial joint where you can see this nice little pad with this green color is articular cartilage. Okay, this nice little cartilage is articular cartilage, and this is working, I must say, ये फ्रिक्शन को रिड्यूस करने के लिए दो बोन सरफेसेस के बीच में होता है, एंड दिस इज़ वर्किंग लाइक अ पैड बिटवीन two bones in a joint, and here this structure is synovial membrane. So okay, if I say this is with this red is synovial membrane, okay, and here this cavity is synovial cavity. Okay, and what is this green structure? This is the cartilage I was talking about. This is articular cartilage, and this articular cartilage is of hyaline variety. Okay, this is of hyaline variety. Three types of cartilage are there now: fibrocartilage, elastic, and hyaline cartilage. This cartilage between two bones in a joint is hyaline cartilage, इसको हम articular cartilage कहते हैं। तो बेटा ऑस्टियोआर्थराइटिस एक ऐसी जॉइंट की डिजीज़ है, जॉइंट इन्फ्लेमेशन है, जिसमें क्या होता है, आपका जो आर्टिकुलर कार्टिलेज है उसकी डिग्रेडेशन होती है, इसकी तोड़ फोड़ होती है। ठीक है, सो द क्वेश्चन इज why osteoarthritis, why degradation of this cartilage? So what are the causes actually? So the causes beta may be some primary causes, direct causes related to bone joint, and some secondary causes. Okay, the main cause behind osteoarthritis is actually this category: primary causes, up to 95%, and some secondary causes are also there that can cause osteoarthritis. We'll talk about those causes. Primarily, the cause of osteoarthritis is idiopathic. That means it is unclear. You do not know what is the exact cause, so that's why we say it is idiopathic. Or some people believe that there may be role of aging or genetics. Okay, there may be role of some genetics or aging, बढ़ती हुई उम्र और जेनेटिक ससेप्टेबिलिटी जो है वो ऑस्टियोआर्थराइटिस करा सकती है। ठीक है बेटा, कुछ सेकेंडरी कॉजेज़ जो कि ऑस्टियोआर्थराइटिस करा सकती हैं, जैसे कि जॉइंट डिफॉर्मिटी, जॉइंट पहले से डिफॉर्म हो, ठीक है, या अगर जॉइंट डिफॉर्मिटी नहीं है तो बेटा कुछ सिस्टेमिक डिजीज़ेस हैं जो कि ऑस्टियोआर्थराइटिस करा सकती हैं, जिनमें सबसे पहले डायबिटीज़ मेलाइटस, और उसके अलावा ओबेसिटी, और उसके अलावा हीमोक्रोमेटोसिस, ठीक है, एज़ पर योर टेक्स्ट बुक, और उसके अलावा ऊक्रोनोसिस। ओके, सो नाउ यू नो व्हाट इज़ ऑस्टियोआर्थराइटिस बेटा। इट इज़ द, ये एक जॉइंट की डिजीज़ है बेटा, और इसमें क्या होता है कि आपका जो आर्टिकुलर कार्टिलेज है इसकी डिग्रेडेशन होती है सादे अल्फाज में। अच्छा, क्यों होती है भाई? उस क्यों की क्या वजह है? कुछ प्राइमरी कॉजेस हैं, कुछ सेकेंडरी कॉजेस हैं। मेनली जो कॉजेस होते हैं वो प्राइमरी होते हैं, मेनली जो रीज़न होते हैं बेटा वो प्राइमरी होते हैं कि, और वो प्राइमरी क्या रीज़न है? इडियोपैथिक, यू डू नॉट नो, ओके। और देयर मे बी सम रोल ऑफ जेनेटिक्स और एजिंग, ओके। सम सेकेंडरी कॉजेज आई जस्ट मैंशनड हियर, जॉइंट डिफॉर्मिटी या कुछ सिस्टेमिक डिजीजेस जैसे डायबिटीज मेलाइटिस ओबेसिटी हीमोक्रोमेटोसिस और दूसरी। ठीक है बेटा। नाउ लेट्स सी द पैथोजेनेसिस ऑफ ऑस्टियोआर्थराइटिस। लेट्स सी द pathogenesis of osteoarthritis. Okay, so beta, in pathogenesis the very first thing is, the very first thing is the very first thing is chondrocyte injury, यानी कि जो आपका ये आर्टिकुलर कार्टिलेज है इसके जो सेल्स हैं कॉन्ड्रोसाइट्स, उनकी इंजरी। The question that must be striking in your mind right now is why chondrocyte injury? Here is the reason. It may be primary cause, it may be secondary cause, okay. So whatever it is, there is chondrocyte injury at the very first step, okay. And then what happens beta at number 2, uh, after this injury chondrocytes then try to proliferate, that is chondrocytes proliferation, okay. And when these chondrocytes proliferate, what do? They release some substances like collagen, okay, प्रोटियोग्लाइकेंस और उसके अलावा प्रोटीएसेस और कुछ इन्फ्लामेटरी मीडिएटर्स, कुछ इन्फ्लामेटरी मीडिएटर्स जैसे कि TGF बीटा, ठीक है, और ट्यूमर नेक्रोटिक फैक्टर और प्रोस्टाग्लैंडिन्स और उसके अलावा नाइट्रिक ऑक्साइड, ओके. This TGF beta, by the way, is further responsible for the release of MMP, okay, that is matrix metalloproteinases enzyme. So at first what happens beta, there is chondrocyte injury, and after that injury chondrocytes then try to proliferate, and while they are proliferating they release some substances like they produce collagen, they produce proteoglycans, they produce some protein degrading enzymes proteases, also they produce some inflammatory mediators like TGF beta, tumor necrotic factor, prostaglandins, nitric oxide. And out of all these TGF beta is the main, is the factor responsible for release of matrix metalloproteinases, okay. So right after this what happens beta, it, okay, then at number 3 what happens, there is loss of cartilage, there is loss of cartilage. You must be thinking why there is loss of cartilage. So I must mention there are two factors that are participating. One is collagen degradation, जो कोलेजन है कार्टिलेज के अंदर वो डिग्रेड होना उसका, और दूसरा प्रोटियोग्लाइकेन जो मौजूद है उसका डिग्रेड होना। जब ये दो मेन कंपोनेंट बेटा डिग्रेड हो जाएंगे तो मेरा नहीं ख्याल है कि कार्टिलेज बाकी बचेगा, उसकी जाहिर है कार्टिलेज लॉस हो जाएगा, ओके. वाई कोलेजन डिग्रेडेशन इज देयर एंड वाई प्रोटियोग्लाइकेन डिग्रेडेशन इज देयर? This collagen degradation is because of release of MMP, and this proteoglycan degradation is due to release of protease enzyme, okay. And you must be thinking from where these two nice little babies are coming from. So here is the answer, my friends. There we go, okay. So in the very first step what happened? Chondrocyte injury triggered by any of these things, okay. Then what happened? Chondrocytes start proliferating. While they were proliferating, what did they do? They released some substances like collagen for their healthy growth, proteoglycan for their support, and they released some enzymes and inflammatory mediators, okay. And then what happened? We saw cartilage is lost. What is the reason behind the loss of this cartilage? ना कोलेजन बचा बेटा, ना प्रोटियोग्लाइकन बचा। क्या रीज़न बना लॉस ऑफ कोलेजन और लॉस ऑफ प्रोटियोग्लाइकन का? Collagen is degraded by matrix metalloproteinases enzyme, and proteoglycans are degraded by proteases enzyme. Okay, and ultimately the cartilage is lost. Okay, right. Now let's see. This is the pathogenesis. This is how cartilage is lost in case of osteoarthritis. Okay, and this is how articular cartilage is damaged, and these two bony surface. Okay, so beta, now you understand the pathogenesis of osteoarthritis. This, okay, this part makes up early osteoarthritis, and this uh, makes up late osteoarthritis. So now you know the events occurring in the early and late osteoarthritis. In early osteoarthritis, chondrocytes were proliferating and releasing some inflammatory mediators, and in late osteoarthritis, cartilage was lost completely because of release of inflammatory mediators and proteases. Okay, uh, now let's see the morphology. The morphology of osteoarthritis. Okay, so beta, in morphology you will see what is happening actually in all these, I mean early osteoarthritis and late osteoarthritis. As I mentioned, I will follow the same things, like okay, in early osteoarthritis, if we follow the same thing, what was happening in the early osteoarthritis, there was chondrocyte proliferation. You agree? Okay, so in early osteoarthritis, there was chondrocyte proliferation and there was release of inflammatory mediators. So same thing is here. Okay, release of inflammatory mediators. Okay, and then what will happen in case of late osteoarthritis? Because of these two things, what will happen? Loss of cartilage. Loss of cartilage. Okay, now what is something that we need to understand in this morphology part is that beta, when this cartilage is lost, so what happens, this cartilage is lost in the form of small pieces, जिसको हम कहते हैं जॉइंट माइस, जिसको हम क्या कहते हैं बेटा, जॉइंट माइस. तो अगर मैं क्विकली एक रैंडम सी पिक्चर आपको बना के दिखाऊं, आई होप आपको समझ आ जाए बेटा. तो आप ये देखें कि ये एक वही आपकी जो है जॉइंट सरफेस है. As you will see, they can, I hope you can get something from this again. uh, okay, now you can see the cartilage is lost from some points, and these are those broken pieces of cartilage which are now in the synovial cavity. Okay, which are now in the synovial cavity. Here again is the, yeah, synovial membrane. So okay, these are the broken pieces of cartilage, and these are called joint mice. As I mentioned, cartilage is lost in small pieces. These are called joint mice. And here you see this articular cartilage is now not smooth anymore. Its surface has been very much granular and very much soft. Okay, initially the cartilage was very much smooth. Okay, and here it has been very much granular, right? So this is the difference you have to keep in your mind. Okay, what is the result of this loss of cartilage? As a result of loss of cartilage, beta, two bones are exposed. Okay, so if I write over there that when the cartilage is lost, what happens, सब कॉन्ड्रल बोन्स जो होती हैं, कार्टिलेज के नीचे जो बोन्स थी, वो एक्सपोज हो गई. वो क्या हो गई? एक्सपोज हो गई. ठीक है, और जब बेटा दो बोन एक्सपोज हो गई हैं और जब वो मूव करेंगी तो ज़ाहिर है उनके बीच में फ्रिक्शन क्रिएट होगा. उनके बीच में फ्रिक्शन क्रिएट होगा, और उस फ्रिक्शन के नतीजे में क्या क्या हो सकता है ये आपने समझना है. बेटा, टू थिंग्स कैन हैपन. द 2 to 3 थिंग्स यू नीड टू कीप इन योर माइंड. इस फ्रिक्शन के नतीजे में बेटा एक चीज़ तो ये होगी कि बॉन जो है, सब कॉन्ड्रल बॉन, उसमें फ्रैक्चर गैप्स क्रिएट हो जाएंगे, उसमें फ्रैक्चर गैप्स क्रिएट हो जाएंगे, और उन फ्रैक्चर गैप्स के अंदर साइनोवियल फ्लूइड जो है जमा हो जाएगा, और ये एक फाइब्रस कैविटी में, फाइब्रस वॉल में इनक्लोज हो जाएगा, और ये एक फाइब्रस सिस्ट बन जाएगा। ठीक है। दूसरी चीज़ ये है कि जब दो बोन्स आपस में कंटिन्यूसली एक दूसरे के साथ फ्रिक्शन करेंगी, तो जो अपोजिंग बोन्स है उनकी अपीयरेंस कैसी हो जाएगी, बिल्कुल पॉलिश्ड आइवरी जैसी अपीयरेंस हो जाएगी, पॉलिश्ड आइवरी जैसी अपीयरेंस। और इस प्रोसेस को हम कहते हैं इबर्नेशन। इसको हम क्या कहते हैं, इबर्नेशन। ओके। सो अब मैंने जो बेटा दो बातें कोट की जो फ्रिक्शन की वजह से एक्चुअली हो रही हैं, अब इन दो बातों को मैं ज़रा कुछ आसान अल्फाज में आपको समझाने की कोशिश करता हूँ। ठीक है। सो इफ़ यू सी हेयर दैट अगेन दीज आर टू बोन्स, ओके, okay, and you see the articular cartilage has been lost and it has been very much granular, right? Its contour is not really good and it's not looking really healthy. It's lost. Okay, okay, still I can draw some mice. These are nice little joint mice. These are the lost pieces of cartilage. Okay, and here you have your synovial membrane. Right. So, okay, this is what you learned so far. Now I will show you what is the result of, okay, friction. Now you can see this is the bone, subchondral bone. You can see some fracture gaps in the bone, right? You can see some, yeah, fracture gaps in the bone because the cartilage is lost, and due to the loss of cartilage, two bones were continuously frictionating against each other, and they have produced some fracture gaps. और जो बेटा आपकी कैविटी के अंदर जो साइनोवियल फ्लूइड था, वो फ्लूइड इन कैविटीज़ के थ्रू, इन फ्रैक्चर गैप्स के थ्रू यहाँ एक्यूमुलेट होगा, और कुछ इस तरीके से एक्यूमुलेट होगा, और इसको हम कहेंगे ये एक फाइब्रस सिस्ट बन जाता है। ठीक है, फाइब्रस cyst बन जाता है. This is synovial fluid leaking out of the cavity through these fracture gaps into the bone, and these are the fibrous cyst for you. Okay, that's it. Now this was all about the morphology of uh, osteoarthritis. Okay, now let me tell you that, now let me, yeah, tell you which joints are involved in osteoarthritis. Which joints are involved in osteoarthritis? So let's see the joints involved. Okay, the joints which are most commonly involved are beta the hip joint, the knee joint, and some small synovial joints like proximal interphalangeal joint, distal interphalangeal joint. Okay, first carpometacarpal joint and first tarsometatarsal joint, राइट. और इसके अलावा कुछ और भी जॉइंट्स इफेक्ट होते हैं, जैसे कि लंबर स्पाइन, लोअर लंबर, बेटा लोअर लंबर एंड सर्वाइकल वर्टिब्रा. ओके, lower lumbar and cervical vertebra. These are the joints which are involved in case of osteoarthritis. And the joints which are spared, which are not usually involved, those joints are wrist, elbow and shoulder, right? That's it. And one thing that I forgot mentioning here is a very important thing that has to happen is, beta, you can you see this bone? This is the bone. What happens in osteoarthritis is this bone outgrowths in mushroom shape or in mushroom like manner. This outgrowth of the bone, which is obviously further kept by the cartilage, covering of the cartilage it has above this outgrowth, this bony outgrowth, this is by the way a bony outgrowth. Okay, this is seen in case of osteoarthritis. This bony outgrowth is called osteophyte. Okay, this is very important characteristic feature of osteoarthritis. ठीक है बेटा. अच्छा, ओके। अब ज़ाहिर है बेटा ये जॉइंट है, तो इसके ये जॉइंट के ऊपर कोई स्किन सरफेस भी होगी, ठीक है। दिस इज स्किन अबव द बोन। अब लेट सपोज कंसीडर कर लें ये प्रोक्सिमल इंटरफेरेंजियल जॉइंट है, ठीक है। और इस जी बेटा, अच्छा, ये जो स्किन मौजूद है इस बोन और जॉइंट के ऊपर, तो जाहिर है बेटा ये जो बोनी आउट ग्रोथ है इसकी जो प्रोमिनेंस है वो इस स्किन के ऊपर भी नज़र आएगी, ठीक है। तो अगेन मैं थोड़ा सा आपकी आसानी के लिए अगर ये बनाऊं तो यू कैन सी दिस इज़ द बोन, ओके। और इस बोन में ये आउट ग्रोथ थी, इसको हम ऑस्टियोफाइट कह रहे थे, ठीक है। अच्छा, अब जो स्किन मौजूद होगी बेटा इसके ऊपर, उसके ऊपर भी प्रोमिनेंस आएगी, ठीक है। तो नीचे विद दिस ब्लैक इज़ योर बोनी आउट ग्रोथ कॉल्ड osteophyte, and this prominence on the skin is called, this is due to osteophyte, this prominence on the skin is called Haberden nodes, okay. These are Haberden nodes, all right, okay. I also told you the joints which are involved, and now this is the time to let me tell you the clinical picture of the osteoarthritis, how the patient comes with what features he or she comes to you, okay. So primarily and mainly up to 50 years of age the osteoarthritis is beta asymptomatic, ठीक है। And if some symptoms appear even after 50 years of age, then what are those possible symptoms? They include उस पर्टिकुलर जॉइंट में पेन, और इसके अलावा मॉर्निंग स्टिफनेस, और इसके अलावा उस पर्टिकुलर जॉइंट में क्रिप्टस का होना, ठीक है। और उसके अलावा जैसे I mentioned that due to these osteophytes some prominence appear on the skin, that are Haberden nodes appear on the skin, Haberden's nodes, okay. Right, now let me tell you some complications of this Haberden node, some complications. What are the complications of these Haberden nodes? If let's suppose these Haberden nodes appear in the lower lumbar or cervical vertebra, what will happen? This outgrowth will compress lumbar and lumbar and cervical spinal nerves, for sure, lumbar and cervical spinal nerves. And as a result of compression of these nerves, you can say what will happen, that there will be some neurologic deficit, because these lumbar and cervical spinal nerves are compressed. So what will happen, there will be muscle atrophy of the muscle to which these nerves were supplying, there will be muscle spasm, and obviously because the nerves are being compressed, so there will be radicular pain, okay, as per your textbook. So now, okay, what is the management? The management of osteoarthritis you will better understand in the medicine, but in pathology you can say the possible thing is pain management by some NSAIDs, and activity modification you need to do, okay. You need to modify your activity, and for make sure if there is severe osteoarthritis, so in severe cases you need to go for surgical repair of the joint by arthroplasty, okay. So beta, this is all about osteoarthritis, and I have shared with you the notes of this topic, and I hope this topic is very much clear to you. If you do not understand anything, you can just comment down below in the comment section, and you can ask me if anything bothers you in this lecture, okay. Thank you so much.